Hello.
Hi, my name is Ashley. I'm a Purdue University Northwest student here, and I'm going to be your nurse. So before I begin here, I didn't see any kind of contact precautions or these signs outside your door that tell me that I need to gown up in any kind of way. So I will not be doing that. I did perform hand hygiene. Can you verify your name and date of birth, please?
Sarah Kralik and 22301.
Awesome. So I checked in your chart. I see that your doctor did order an NG tube insertion. Now, you're getting this procedure done by me today because you're experiencing some kind of gastric immobility. Sarah, this procedure is quite uncomfortable, but I will talk you through everything, okay? I did close the door behind me. I did close the curtain behind me to establish some privacy for you to make sure you're comfortable too. Now, before I begin, I'm going to raise the bed to comfortable working height. Okay, Sarah, your bed is at working height. You are in the correct position, the high Fowler's position for the correct insertion of the tube. I'm going to drape your chest here with the pad, just like this. Then I'm going to place an emesis bin on your lap. And then I have tissues on hand as well, if and when you would need them too, okay? All right, next step is I'm going to measure the NG tube. I'm going to measure it properly so I know how far to go. All right, Sarah. I'm going to measure starting from the tip of your nose to your earlobe. I'm going to make my way down to your xiphoid process. Okay? So tip of the nose to the earlobe. Okay. To the xiphoid process. It's going to be roughly down here. Now I can actually put some tape on it to measure. I do not have a marker on hand. Okay. It was at 55. All right. Okay. Next thing I'm going to do is I'm going to put lubrication on your tube, but I'm going to be putting gloves on. Then I'll begin the procedure. Okay, Sarah, I'm going to put some lubricating jelly on. About 2 to 4 inches. Okay. Are you ready?
Yep.
Alrighty, so what I'm going to have you do now is I'm going to ask you to tilt your head back against your pillow. Just far enough where I'm going to start inserting here. Now I'm going to insert it until I hit my little marking. So here we go. You ready? All right. It's normal for you to feel like you're going to gag a little bit, like you're going to cough, especially when I hit the pharynx. But if you experience some kind of shortness of breath, you can't breathe at all, let me know and I'm going to stop immediately. But you're doing very well. We're getting somewhere. We're pushing down the tube here. We're almost to my mark. We hit the pharynx. Now, Sarah, I want you to tilt your chin down to your chest. Perfect, just like this. And each push now that I'm going to do, I want you to swallow, okay? So ready? Swallow. Okay. Swallow. All right, we're almost there, and we're there. We met our mark. You're doing awesome. You're doing a very good job. How are you feeling?
Great.
Okay. All right, Sarah, I'm going to apply some tape so the tube itself stays. All right, you're doing really well here. You're doing really well. All right. Okay. Tape is firmly on your nose. How does that feel?
Good.
Awesome. All right, Sarah, I'm going to put some cream around your nose, some lubricating cream. All right. So next thing I'm going to do is that to make sure that I put the tube securely in your stomach, I'm going to actually, 1, have an x-ray done for you, or 2, aspirate some gastric contents. I'm going to do the second one for you today. I'm going to aspirate some contents for you right now, okay? So I'm going to get my syringe, insert it, and then aspirate some. Here we go. Okay. I'm getting some fluid. The fluid is clear and it looks as if it has it's bile colored. Okay. Gonna dispose of it in my bin here. Measure some pH. pH measured. Okay. All right, Sarah. Now, after all that's said and done, I did apply the lubricant around your nose already. I'm going to assist you with some oral hygiene. I've assisted with your oral hygiene, and now I'm going to return you to your comfortable position, and then that concludes inserting the nasogastric tube. Hi, Sarah. Okay, so I did get an order to remove your NG tube. So how are you feeling?
Okay.
Are you excited? I get to remove the tube today. So what I'm going to do, I perform hand hygiene. I'm going to put some new gloves on. Okay. It's going to be a quite quick procedure here. All right. Okay, Sarah, what I'm going to do now is I'm going to remove your tape. So bear with me for 2 seconds. All right. Tape has been removed. I'm going to fold your NG tube. Okay, like so. Now, before I tug on this thing, Sarah, I'm going to need you to take a really deep breath for me and hold it. And when you do that, once you hold your breath, that's when I'm going to take out the tube, okay?
Mm-hmm.
So I want you to take a deep breath right now and hold it. Here we go. I'm going to remove it now. Okay, good job. I'm going to fold it like so. I'm going to dispose of it according to hospital policy, and then we are all done.